Addison's disease then and now, or hypoadrenalism. In those days, it was thought it is caused through tuberculosis. Addison, in fact, in 1985, is the man who diagnosed pernicious anemia. And he is the one who did post-mortem, and he found these adrenal glands were shrunk. He was a doctor, he will not sleep until he found the cause. Very dedicated man, and he is known as the father of endocrinology. And also, of course, his name, Pernicious Anemia, also was coined by him because, like Martin said, it is a fatal anemia. 2 lives saved in my practice by looking for it. Not to say that they only have B12. And this is the normal circadian rhythm. From about 4 o'clock in the morning, we are getting prepared for our day-to-day tasks. And you can see slowly the cortisol level rises. The normal morning cortisol level we expect is 550 to 750. And you may notice in the afternoon it starts to go down. Why? Because it's preparing us to go to bed. So the level drops to about 100. Now, this is a patient who was diagnosed before she came to my practice with everything under the sun. And she was collapsing, fainting from age 14. She was diagnosed as epilepsy. She was diagnosed with various conditions, which I'll come to you. And then she joined our practice in 2009. She had B12 deficiency. I corrected the B12 deficiency. I looked for other things. Vitamin D, corrected that. Still, she wasn't right. So I did the cortisol level. Dr. Siddha mentioned about it, the importance of it. And you may notice the levels are, basal levels are, the expected level is at the top. And so I duly referred her, those 2 pink color, to RVI. And there they did this well-accepted Sanactin test. That's a stimulation test, and they give large doses of adrenocorticotropic hormone. That supposed to stimulate the adrenal gland. And on both occasions, the consultant wrote back to me saying that it is suboptimal. And in spite of the fact they didn't follow her up. And these are the Sanactin tests they did. You will notice the first one was only up to 550, but the others are very low. And then in blue, you will see it was only 2 months ago. I found she was near to death. And her level was 34. And I referred her to James Cook Hospital. These are the 3 hospitals previously relied on high-dose ACTH, and they didn't take notice of the signs and symptoms that she was fainting. She had to sell her house and go and live with the parents because she was a danger to herself. This is her. From age 14 onwards, dizziness, fainting, tired, weak, cold all the time, nauseous, weakness, muscle cramps, hair loss, IBS, stomach pain, depression, panic attacks. And she was diagnosed prior to that. Of course, she was B12 deficient as well. All the other conditions, ME, CFS, fibromyalgia, all these conditions. This is another patient of mine. This is a lawyer, 28-year-old first when we started to suspect something is not right. A very bright girl who studied at University College London. And she also knew something is not right because she had difficulty remembering things. She was getting angry, upset, the parents said. And you may notice in 2008, I suspected that she is hypoadrenal after having excluded other conditions. And then I referred her to RVI, and her level was low, it was 70, and they said it is all in their mind. The muscle biopsy even shows in this 28-year-old girl damage to her left leg muscles. Her reflexes were diminished. One day, the husband rang me at 10 o'clock. Dr. Chandy, she is on the floor, she can't get up. And she has 2 little girls. At that time, 3-year-old and 1-year-old to look after. Then, one day she couldn't breathe, she couldn't talk, and I was called out. Admitted to local hospital, Hartlepool Hospital, and they referred her back to James Cook. At Hartlepool said it is all in the mind. She's putting it on. At James Cook, they did all the tests, and they also said, I think she need to see a psychiatrist. So it went on like that, 3 hospitals rejecting her, and I decided I must act. Though we GPs are not allowed to diagnose and treat, I started her on hydrocortisone. Probably if I didn't, she would have died. And you may notice, in spite of having the hydrocortisone treatment, her adrenal gland or the pituitary gland was damaged. Her level one morning was 34. So is she hypoadrenal? She hasn't yet got a diagnosis from our respectable professors of these teaching hospitals. This is the synaptin test she had at RBI. And you may notice there is a near normal curve after 60 minutes. It is measured at 30 minutes and 60 minutes, and of course the basal. But even there the basal was low. So every other hospital, every professor said she is okay. This is the hydrocortisone day curve, which is usually done at hospital. But because her condition was so serious, I did this myself. Because people will say, oh, you give steroid, and you can get the opposite of hypoadrenalism, which is moon phase, Cushing's syndrome, osteoporosis, gastric ulcer. But here, we measure the hydrocortisone day curve and make sure the level never goes above 500 that it matches the diurnal variation or the circadian rhythm. Here you can see we have still way below the circadian rhythm. This is the patient, and you can see she had all the symptoms which you can class as fibromyalgia, or which they did, chronic fatigue syndrome, or it is all in her mind. So there is, you can see they were only concentrating on the adrenal gland, but this autoimmune process can affect the pituitary as well as the hypothalamus, and I believe even the suprahypothalamus. No test can really point out exactly where the trouble is. They were pinning it all on just the adrenal gland, and they're missing. Also, they are using high dose stimulation instead of physiological dose. So the physiological dose they should use is 1 microgram. Instead, they are using 250 microgram. Why couldn't they do the low dose, which is also in journals and it is done? Instead of saying that it is all in her mind, she should see a psychiatrist. And she would have been dead and gone by now. So there is primary hypoadrenalism, which Kennedy had. Unfortunately, at that time, glucocorticoids were just available, and that saved his life. Otherwise, he would have died. And also B12 he was getting, because at that time, in 1945, B12 was identified by Dr. Smith in London and someone else at the same time in USA. So you can have secondary or tertiary or suprahypothalamus hypoadrenalism. They are not looking for it, unfortunately. So there is just like pernicious anemia and the problem, this is a huge problem what is happening. Many of these patients are put on depression tablets or they become psychotic. They are very powerful poisonous drugs. That is what is going on, which is very, very sad. So I went on discovering in the last, since that girl we saw, it has alerted me, my clinical mind is alert, and I make sure everything is tested, like the polyendocrine group of things, and any essential elements that is missing. If you correct them, just give you quickly an example. This is a very clever patient of mine. His mother, sister, they are all B12 deficient. So he came with all these neuropsychiatric symptoms. He read up like you all, and I found his B12 level was 126. So I started giving him injections and he improved. But something still was not right. He was having headache. He kept on coming and seeing my colleagues and myself, and we couldn't find the cause of the headache. So because he goes and sees the other doctors as well, there was no continuity. He got fed up, got angry, and he changed the doctors. He went to another big practice. Within 2 weeks, he came back to see me apologizing. Then I thought it is time I put my thinking hat and I looked through all the tests other doctors have done, and I found his thyroid TSH level was 4.5. That is marginally he is hypothyroid. But of course, clinically, it is more than marginal. I started to give him 50 microgram of thyroxine, and he came in 1 week and said, Dr. Chandy, I'm fine, and gave me a big hug. I'm sorry for leaving your practice, you have saved my life. So you can see these, everything, we doctors must look for all these things. So these are the other patients. You can see her, the way she came to see me, and see the difference. Now, she is B12 deficient, her mother is B12 deficient, and this boy was brought to see me. I told someone else today. Her daughter is B12 deficient, and this boy was brought to see me. Will you take him to a mental, referred to a psychiatrist? Because he's very disruptive. He may have autism. Will you refer? I asked her, what is the matter with you? You're B12 deficient. You're well now. Your mother is B12 deficient, and your 16-year-old is B12 deficient. Don't you think little Johnny has B12 deficiency? You could diagnose it. I said, you don't need me. So before referring to a psychiatrist, let me check the B12 level. His B12 level was 194, and started giving him injections because they were going to throw him out of the school. 1 month later, the headmistress ran after the parents and said, look this, a certificate saying that he's the best improved student in the class. Just a few weeks ago, she came and told me he's going to get a scholarship for a brilliant boy. And then you may notice she has become hypoadrenal after 2 years, and you can see her face. And B12 alone, or thyroxine, she had colitis, she was referred to the specialist. Everything reversed since I started. She couldn't get out of bed to go to school. And now she's back to normal. I have another photograph showing how she is well, but I don't think that's here. This is a girl again, came to me from another practice. Her B12 level was 170, which dropped to 132. After correcting it, she was fully well. Where I checked her cortisol level, it was 133. And I started her, I didn't bother to refer to this specialist. I thought I'm going to treat her, and you can see she's smiling. Previously, she worked for her dad, and in between she had to go and lie down before she could get up. This is a case of vasculitis, which was diagnosed by the specialist as urticaria. She came to see my colleague. Colleague said, you better go and see Dr. Chandy. So she came to see me, she was on a bucket full of Piriton and all that. And one look at her, I said, I know what's the matter with you. I said, you have two problems. One is you have B12 deficiency, and two is you are hypoadrenal. And I was proved right. Her B12 level was 243. You can see I gave her 5,000 microgram of B12 straight away. And also I gave 100 microgram of hydrocortisone intravenously. And within days, it cleared itself. This is the lady who had been to, am I all right for time, Hugo?
Speed up.
Okay. This is the time I always go overrun. I get excited seeing you all, I think. So forgive me, Martin. I get carried away. You see, when you see this smile, doesn't it make you all well? For 4 years, she was going to James Cook Hospital. And they said, you have gastritis. Take some antacids. Oh, you have sugar craving. Go and have some chocolates. She couldn't breathe. So they put her on inhalers. One inhaler had a cortisone, steroid inhaler. So that gave her some relief. It went on and on. She is from Hartlepool. She is not from my district. She found Martin's website, and somehow somebody mentioned about me. And I was about to go to India. She rang me and said, Dr. Chandy, I'm desperate. I want to come and see you. I said, you're not my patient. Okay, I'll see you when I return. So when I returned, I rang her on a Sunday and asked her to come. So she had B12 deficiency at 273. And of course, it is JP or the James Cook couldn't treat. So she came and I checked these things and I started treating her. Oh, she was so happy. In spite of that, there was something missing. Something was not right. And James Cook 4 years ago did do her cortisol level. And again, it was using the high dose synactin test. And they did diagnose. So I did series of early morning cortisol level and I found she was hypoadrenal. And I started to treat her, she improved. I referred her back to James Cook and now they admitted they were wrong. And this is another girl, young mother with a child, sad case. It's just recently I did series of cortisol levels. She's B12 deficient. Her level is, I think, 130. Started treating her. Then I found she has cortisol deficiency of 160. Slowly came down from 200 down to 160 and 140. I sent her to Hartlepool Hospital. They did the high dose synactin test, and I got a letter yesterday. It really broke my heart. Oh, she hasn't got hypoadrenalism. Go away. But I told her not to worry. I will follow you up and I start treating you. Even if I will lose my registration, I'm going to risk my career for you. This is another lady who went to James Cook and Hartlepool, misdiagnosed. Now she is better. So these are the signs and symptoms. And I have created my own protocol based on my patient experience, not from textbooks. You learn more from life. You learn more from patients. That's the basic thing. Instead of that, we doctors now concentrate on looking at the computer and tick box so that they can get the highest cough points. So that's the... So by this time, this doctor who came for 20 minutes to see me and to see what is going on, why is he doing so many cortisol? He is an outlier. I was going to, of course, again going to be reported. Like last night I mentioned, twice my patient's B12 treatment was stopped by the 2 separate PCTs for a period of 15 months. And one patient died of pneumonia during that time. Are they going to do the same? Stop treating with the hydrocortisone? You are not an expert? This may be the reason why he came. But he only came for 20 minutes. And by the time he left, it was 3 o'clock in the afternoon. So by that time, he laughed. Because he asked me, Dr. Chandy, in 2002, you wrote to Tony Blair about the health service. So, never mind. I wrote to Tony Blair when he came into power about what is wrong with the NHS. And I did 2,000 copies, sent to every MP, sent to every chief executives, and I knew danger. So I told him I had a protection there. Who was it? I said I wrote to Cherry Blair at the same time and enclosed this booklet. And also I put a congratulation card. That is the time Cherry had the baby boy. I forgot his name. So I said, also I put a third thing, which I'm not going to tell you. Well, actually I told him and he laughed the head off what I inserted. And I said, that is my protection. So many chief executives and all tried to see whether they can do something with me, but you can see I'm still practicing. So then he understood. Now I know what you meant by destiny. And that is why you're here. I can see that. But please take care of that girl. As I told you, I lost a baby girl in 1979. After 7 years, with a lot of prayer, we got a baby girl. And that was that girl you saw, second patient. She's Leanne, she's my daughter. And if it isn't for her becoming ill, I wouldn't have branched off into this. Since she became ill, and when this hospital rejected her and said it isn't mine, day and night I studied. And now I am also diagnosing other patients. And I am hoping we can publish this and that I can influence the establishment to change their policy. I will stop there. I don't know whether I am over.
First time in 4 visits that he has actually finished early. The very first conference he went on for 3.5 hours.
I'd just like to add to Dr. Chandy that I handed out, but we don't have enough for everybody, a protocol for the treatment of hypoadrenalism.
Oh, great.
So your doctors can use this. It's straightforward, it's been verified by a number of doctors. It is for hypoadrenalism. You'll notice it's slightly different from the handout next to the poster, which everybody can take a copy of. This is a protocol for the treatment of B12 deficiency. Now this one's been approved by the local medical committee, it's been reviewed and approved by the General Medical Committee, the GMC. So you can take away copies of this, and we've handed out every copy we've brought of this. You will also find, you remember looking at the photographs, and you probably like looking at the photograph, you will also see there's a patient case studies book. Please make sure that we get these back. By all means look through, they've got 20 or 30 case studies of patients in them, but we do need them back at the end. And there's a poster up there explaining B12 deficiency. Thank you very much.
Other questions? We've got time for 2 or 3 questions, only if anybody would like to ask. Yes?
You were talking about cortisol levels, but do you prescribe a diet to your patients? Do you tell them what to eat, or what do you think about the food they eat?
I have a holistic approach, as you may have noticed.
Yeah.
I go into every aspect, the diet, any other conditions they have. And also many of these people come with a broken heart. And also there is a lot of anger because we doctors have let them down. So just now I was talking to a lady who is in a terrible state. I'm going to help her. And I said, all these things I will do for you because I work for the B12 Deficiency Support Group charity. The B12 Deficiency Support Group was formed to defend me and protect me, which they did. Otherwise, I wouldn't be standing in front of you. And they have become a charity, and we want to help people. Charity